Hi, I'm Dr. Amber. I'm a small animal veterinarian who specializes in rehabilitation and advanced aging in our pets. And I thought, since I have a unique clinic and the majority of our pets are between 12 and 23 years old, that I would share some of the questions that I get asked on a daily basis. And I think the first one is a good one and it's pretty poignant. I kind of get asked every day, if it was your pet, what would you do? And it's kind of a loaded question, right? I mean, I've had my own pets. I've been in this industry a long time. I deal with a lot of chronic and debilitating conditions with the rehab and the advanced aging. So there's kind of a way I look at it, and it's how I look at it for my own pets, but also how I recommend my clients look at things is I have a checklist. The checklist of what's okay and not okay, right? What's okay for me to do with and for my pet, what's okay for my pet to have me do with them and for them, right? So I have this checklist and I usually do kind of my minimally invasive list. It's a good checklist for blood work, x-rays, ultrasound, things that can give me the most information on what I'm managing and handling, and a way to monitor my success or my not success with whatever the condition is. My next one is my reasonable and non-reasonable treatments, right? So, and it will depend on your pet. Not every pet loves being handled. Not every pet will take meds easily. Not every pet likes injections or sub-Q fluid. So we have to have a reasonable plan for both parties involved, right? And then the what's not okay list. And I think this is the biggest one for me on picking whether you're going to do chemo or not, whether you're going to do surgery or not, whether it's end of lifetime or not, is if where we are is okay. And okay is different for every family, every pet, every condition. But if the pet is happy and still trying and not tired of being ill, then I usually will say, let's keep doing reasonable things and move forward. If my family is fatigued, if my pet is tired, if I can't cure or completely resolve a condition, it does also change how I look at this. So I'll tell you quickly about my cat. She was 17 years old. She had been healthy her whole life, and as a 17-year-old cat typically does, she went into renal failure. So I started with monitoring her blood values. I did subcutaneous fluids, so I did lift her little skin, poke her with a needle every other day and give her fluids at home. I had her on supplements and I had her on a kidney diet. So I started monitoring her blood work and she wasn't getting better. Her kidney values were persisting. So I added in some additional treatments. We did some additional diagnostics. So I did an ultrasound of the kidneys and I found out that she actually has renal cancer, which is causing her renal disease. So then that changed my whole perspective of what we were managing here, right? And around this time is when she started saying she was not okay with being sick. She was not okay with me giving her sub-Q fluids. She was not okay with taking all the medications and supplements. So I reassessed where I was with her and what my end goal was. My end goal was her still being my wonderful cat and me and her still having a great relationship until the end. So I did stop my sub-Q fluids. There's no need for me to do that if she didn't like it. I did keep her on the kidney diet. I did get the medications I could into her. And the biggest concept for me with her at the very end was she said I was tired. She literally laid there and just said I was tired. And somebody described it to me in this wonderful, beautiful, poetic way of, it's not that I'm giving up, it's just that I'm tired. So I honored her decision at this point, and I also realized that I didn't have control over this situation. I am helping manage, I'm helping support her, but ultimately her body was deciding what is happening or not. I was just trying to make this as graceful as possible for her. So when people ask me what would I do if it was my dog or my cat, as a vet for my clients, I look at my relationship with them, how well I know what they like, what they want, what their wishes are, how well I know their pet, and the type of condition will change every perspective. You know, whether I choose to do surgery in a 14-year-old with a splenic mass, it depends on how anemic and tired the pet is. Whether I decide to do stifle surgery on my geriatric Chihuahua is probably going to be different than my 2-year-old Labrador, right? So they're all different cases. So there is no right or wrong answer, but have a checklist with what's okay and not okay, what's reasonable. And reasonable is time budget reasonable, emotional budget reasonable, and financial budget reasonable. It is not reasonable to go into debt to try to fix an uncurable disease. It is completely reasonable to spend those resources making everything as good as you can. So remember, if you do trust your vet and you do ask this question, I would have your list of what's okay and not okay and try to have that conversation with you knowing what you expect and asking them what they would expect with whatever condition you're handling. So, hope you all have a great day. Feel free to DM me if you have more questions of the day, and I'll keep telling you guys what my clients ask me. Have a great day.